Dr. Mark Zuperi, board-certified plastic surgeon practicing in Toronto. Body implant is a strong interest to me. One of them is pectoral augmentation with implants, which I've been performing since 2004. The majority of the patients requesting pectoral augmentation are relatively athletic guys who, despite all the gym activity, cannot grow the muscle. So the guys are looking for muscle mass and definition in their upper chest. A pectoral implant is made of silicone material. It is solid as opposed to a breast implant, which is a gel. So this is a solid elastomer which is extremely soft and pliable. The implants are inserted via a small incision in the underarm area within the hair-bearing part. The implants are inserted underneath the original pectoralis muscle, so it blunts all edges. The surgery takes about 2 hours under general anesthesia. We have several shapes and size of pectoral implants in Canada. My most common two implants are the following. This one is a triangular shape implant made in Brazil, and this will be often used for patients who are looking for an athletic swimmer type of upper chest. It does mimic the triangular shape of the original pectoral muscle. My second subgroup of population requesting pec implant are the bodybuilder population. So in that particular subgroup, we're looking for bigger, squarer, thicker muscle, and we will often choose this larger square implant. Anyone who undergoes pectoral augmentation with implants will be able to continue to go to the gym and bulk their original muscle. Now, pectoral augmentation with implant is also used on patients with some congenital anomalies. A common request in my office is for patients with Poland syndrome. Poland syndrome is the absence of part or completely of the pectoralis muscle. So patient presents to my office with an obvious asymmetry between the right and the left side. So in those particular situations, usually one implant is recommended on the smaller size, and the aim is to match the other size. Now, those implants are all carvable, so it does allow the plastic surgeon to carve and sculpt the implants to better match the other side. Another congenital anomaly that I commonly see in my office is a condition called pectus excavatum. A pectus excavatum is a depression in the mid-chest area of the chest bone. This can be treated in different ways, and occasionally pectoral augmentation is the solution. In most cases, however, pectoral augmentation is not the solution for the pectus excavatum, and in those particular situations, I recommend a custom-made implant. A custom-made implant procedure is a two-stage procedure. First of all, the patient will come to the office, and using a plasticine-like material, we will build an implant as a mold that will fit exactly in that patient's particular defect. That mold is then sent to the United States, where it will be fabricated in a soft but solid silicone elastomer, will be cured, sterilized, and sent back to Canada. At that point in time, the patient will be taken to surgery, and the implant will be inserted into the defect. A small incision is required for this procedure, usually located below the chest bone and below the ribs, and the incision is approximately 3 to 4 centimeters in size. Pectoral augmentation with implant is not a common procedure in Canada. That being said, I have been performing this procedure for many years, and I have a strong interest, which has driven patients from all corners of Canada to my office. So it is important for you when considering a pectoral augmentation to seek a plastic surgeon who has a strong interest in the procedure, but also many years of experience.